Welcome to the lecture on the lymphatics and osteopathic interface with the immune system. The first thing I would like to say, and it's probably self-explanatory, is that I am not an immunologist. The immune system is an incredibly complex system. We've seen lots of evidence of that, particularly in the last 3 years, and I don't pretend to have a grasp on its diffuse complexity. What I am really interested in is how we might influence it as osteopaths. I'm always thinking about how to support health in my patients, and the immune system, of course, is an important part of that, and the lymphatics is a significant part of how we resist infection and fight disease. So when I'm thinking about how to support my patients' health, particularly in terms of resistance to disease and fighting infection, the first thing, if I'm being really honest, the first thing that I will think about is what is going on with their nervous system. If my patient is stressed and their sympathetic nervous system is activated, then as we know, they are likely to be also producing cortisol, and the cortisol is going to be down-regulating, inhibiting the production of white blood cells. So I already have to be thinking about that in my consideration. The second thing is that if their sympathetic nervous system is activated, their muscles and their connective tissues are going to be tense. And this leads really nicely into the second thing that I would like to that I tend to be thinking about in terms of how to support my patient's health in this environment, and this is the lymphatic system. So as you know, the lymphatic vessels are deeply embedded in the connective tissues. So if we have muscular and connective tissue tension, that's going to impede flow through the connective tissue systems. And if we have impeded flow, we have reduced filtration in the lymph nodes and the lymph follicles. As osteopaths, really, regardless of what system we're thinking about, we are always trying to think about, how do I support motion? How do I support flow? Is this system able to move properly, healthily? And if there's any structural impediment to flow, then that's going to affect our patient's health. And this is particularly important when we're thinking about the lymphatic nervous system. So for me, the lymphatics are really important because they are an accessible structural handle, if you like, into engaging with our patient's immune health. And I don't know whether it's just because of COVID. I don't think so. I think also because of the global levels of stress and anxiety in connection with the environment and politics and war, our patients' health is being more challenged. This is my experience in my practice, and I'm having to consider more often, how do I support my patient's recovery from an infection which is lingering, or how do I support their resistance to becoming reinfected? And thinking about lymphatic flow as well as their nervous system is a really important part of this. So when we move on, these are some of the things that we want to be considering. But before I talk too much about the structure of the lymphatic system itself, I want to spend a little bit of time just considering some aspects of our early immune resistance. I'm not going to talk comprehensively about that. These are subjects for another lecture, but it's important that we set the context. So how we might think about early resistance to infection in utero and just after birth. And then when we've talked a little bit about that, then we'll move on to the structure of the lymphatic system itself. And my particular interest is, how do we influence that as osteopaths? How can we be how can we use it as a therapeutic tool?